Today's topic is drugs for anemia, and anemia is a decrease in the erythrocyte level and hemoglobin level in the blood. So the reason for the anemia can be most common reason for the anemia is lack of the iron. So iron deficiency anemia is the most common type of disease and can be seen in quarter of the population in the world. And if we look at the drugs for the treatment of the anemia, there are three types of the anemia. So the most common one is iron deficiency anemia, and the treatment is the iron. So either taken either orally or intravenously. Then the folic acid and B12 vitamin deficiency anemia is a another type of the anemia is megaloblastic anemia. Can be seen in patients that are starving, and also in pregnant women because of the increased need in the folic acid. And then darbepoetin and apopoetin alpha are the stimulating factors for the erythropoietin synthesis that can further increase erythropoiesis in those patients in whom the erythropoiesis is decreased. That is usually cancer patients or patients that are planning for transplantation. So then there are also drugs for the treatment of neutropenia that include the filgrastim and sargramostim, and the polyethylene glycol derivatives of filgrastim, that is pegfilgrastim, and TBO filgrastim, that is long acting. And then also the sickle cell anemia is a rare disease that is genetically transferred. It's hereditary disease, and hydroxyurea and pentoxifylline is used for the treatment for the decreasing the symptoms of the disease, but the disease cannot be cured completely. So these are the main drugs for the treatment. And the most commonly seen disease that is iron deficiency anemia can be easily treated with iron preparations, and most of the time the iron preparations are taken orally because this is most convenient way of administration, and usually most patients can absorb iron in required amounts, unless the patients have surgery at the stomach, or have bacterial disease of the GI. The oral preparations can be used if there is no any of these conditions. So, and most of the patients, they don't have these conditions, so that is why most of the patients will be prescribed oral iron preparations. And there are many types of the oral iron preparations, uh, uh, including the different chemistry, because the iron, so it can be iron sulfate or iron gluconate, iron fumarate, and many other preparations, and they all are equal in the efficacy, and the only difference is in the total elemental iron content, because despite the same dosage, like 325 milligram of the tablet, uh, every of these uh, preparations will have different elemental iron content, and the highest content is in ferrous fumarate, is up to 100 milligram of elemental iron, and iron sulfate has about 60 milligram, and gluconate is about 30 milligram. So the higher is the elemental iron content, the higher is the frequency of the adverse effects. And adverse effects include the nausea, vomiting, diarrhea, and constipation. So that is why, to minimize the adverse effects, it's recommended to select the low doses of preparations, or the preparations with the lowest elemental iron content. And also the cost of the treatment is different, so it's recommended to use the uh, drugs with the lowest cost, because uh, the all the all of these preparations are equally effective in the treatment of the iron deficiency. Uh, and with the oral iron administration, the absorption rate of the iron is usually limited to 25 milligram per day. So if higher loss of iron is seen, for example, during the uh, uterine bleeding after the multiple births are given, and the patient requires higher higher iron uh, concentrations absorbed, so that is usually indication for the injectable iron formulations. So because with the injectable iron, uh, the patient uh, uh, can be administered, and the uh, and absorb the iron up to 1000 milligram per day. But only 25 milligram per day can be absorbed efficiently with the oral iron administration. Additionally, usually the oral iron administration treatment will take at least 6 weeks, and many physicians will also suggest to continue the treatment after the symptoms will resolve, to replenish the iron supplies in the body up to 6 months. So the treatment can be as long as half year. So, and that is why the drug with the lowest cost should be chosen for the treatment, uh, because actually the type of the drug will not affect the efficacy of the treatment. And about 70% of the patients will complain for the side effects and will stop and will discontinue the treatment because of the side effects, and that is why it's important to uh, uh, explain, and decrease the dose if the side effects are intolerable, and also to encourage patients to take the medicines correctly. So oral preparation should be taken 2 hours before or 4 hours after a meal, because the meal will decrease the bioavailability of the drug and also will increase adverse effects, because usually food will contain the uh, uh, two valent cations that will uh, prevent the absorption of the iron, so they will compete for the same transport systems in the duodenum. So the iron is absorbed in the duodenum, and that is why the anti-coated tablets will decrease the absorption and are not recommended. Also long-acting drugs. So the uh, modified preparations are also not recommended. To increase the absorption rate, the slightly acidic pH is favorable, and that is why it's recommended to take the drug with the 250 milligram tablet of the ascorbic acid, or to advise patients to take a drug with the half glass of the orange juice. So that will give slightly acidic pH that increases the absorption rate uh, from the GI, and uh, this will increase the bioavailability of the drug and decrease the adverse effects with the GI. Other adverse effects include also the metallic taste and the green stool, uh, but usually are good, well tolerated. Uh, it's uh, it's it's not allowed to take the iron preparations with the proton pump inhibitors and with the H2 receptor blockers that can be commonly used to treat the adverse effects like GI adverse effects. And the if patients are not tolerating well the oral preparations, the injectable preparations can be used because the contemporary injectable preparations are safer, much safer than the dextran that has been used for um, 20 years ago, and that is associated, and the use of this dextran iron was associated uh, with the anaphylaxis and all even the deaths, and that is why most physicians don't like parenteral preparations, so and prefer oral. Still, the newer uh, 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 injectable iron preparations are more safe and can be used in those patients who are, have done surgery on stomach or stomach resection, and that cannot absorb iron for any reason. So, and injectables are can be easily tolerated, and so the the only adverse effects is a skin rash at the site of injection, and the uh, the dosage is actually much easy done, and absorption rate can be much higher than with the oral administration. Um, so and also in some patients that have a bad compliance with the oral preparations, injectable preparations can be also used, and because they have higher iron content and can bypass the absorption proteins that are required for absorption of the iron from the GI. Um, this is the most common drugs used for the treatment of the iron deficiency anemia, and for the other types of the anemia like folic acid deficiency, the folic acid should be prescribed, but usually folic acid is a part of the food and can be treated with a diet with a food rich in folic acid like cereals, and some physicians will even recommend using the artificially uh, in, enforced foods with the folic acid, and also cyanocobalamin can be also injected or given orally. So and for the cyanocobalamin, one injection is enough, is will uh, 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 will last for the half year, because the supplies, the body supply of the vitamin B12 is uh, lasts for half year. So and for the sickle cell anemia, there is no treatment, so the treatment is just supportive, and to reduce the progression of the disease, the hydroxyurea can be used, or folitropin. So these two drugs can be used for the prevention of the development of the prevention of the progression of the disease, but unfortunately the disease cannot be cured completely. So that is all for today. So if you don't have questions, I think we can conclude.